In this next section, we are going to talk more about treatments, including medical therapies, clinical trials, liver-directed therapy, and PRRT. There are many treatments to choose from, and it can feel confusing and overwhelming. So I'd love to hear from each of you. What would you share with a NET patient who is considering the many treatment options for NETs? Dr. Hendifar, let's start with you.
Oh, this is a really tough issue that we have to deal with daily. I would try to get into a detailed discussion of the risks and benefits of each of the treatments and to go over with the patients what I think is best for them and why. And definitely it's important to bring the patient into the decision-making process as well.
Thank you, Dr. Hendifar. Dr. Lee, what about you?
Yeah, just to add on to what Dr. Hendifar said, I think for many of our treatments, we actually don't really know which treatment should go first and which should go later, and that's okay. Because oftentimes with this diagnosis, it is truly a marathon rather than a sprint. And as a result of that, ultimately, we will have to go to all of these treatments at a certain period of time. So I wouldn't necessarily put too much pressure on yourself in most scenarios when you're choosing one treatment over another. It's really try to go with the best judgment and keep on going.
That's reassuring, Dr. Lee. Mary, what are your thoughts on this?
This one was really easy for me. I would say for sure the most important thing I could possibly suggest is make sure you're seeing a NET expert with a multidisciplinary team, such as Dr. Lee and Dr. Hendifar. I can't stress this enough. I mean, I feel like I've been a broken record on our weekly calls. Anyone that's a new patient, to tell them this. It's so important. Even if you have a current healthcare team, don't be afraid to research other options for your treatment management. And it doesn't matter what stage of diagnosis you're in either. There's just so much room for varying judgment with such a complex cancer. And collaborative decision-making is just so critical. And you should really feel secure with your team and know that they have your best interests at heart.
Thank you. It's helpful to hear a patient perspective. Beth, what about you?
I'm very much on the same page with Mary. And for me, my first stop is always going to be with my amazing NET specialist who happens to be sharing this conference with me, Dr. Dan Lee. And, after I've discussed things with him, my next stop on my decision train is going to be with my NET family. My NET family gives me a place where they understand the unique language of living with a chronic disease and provide me a space where I can share my concerns and my questions. And having this network of trust and support equips me and makes me feel more confident in going further ahead and in making informed decisions for my own treatment.
That's really insightful, Beth. Thank you for sharing. So we're now going to introduce our next set of speakers.
I'm very excited to introduce Diane Reedy, medical oncologist from the Memorial Sloan Kettering Cancer Center. Her talk is titled NET Treatments, Medical Therapies, and Clinical Trials.
And I'm honored to introduce Dr. Osman Ahmed, who's an interventional radiologist at the University of Chicago, and he will be discussing the latest in liver-directed therapy. I would also like to introduce Dr. Thomas Hope from UCSF, who is a nuclear medicine physician as well as a radiologist, who really focuses on neuroendocrine tumors, and he's going to be discussing with us the latest in NET imaging and PRRT.
For our Spanish-speaking audience, Dr. Reedy's presentation is available to view in Spanish on our website. Thank you to our presenting sponsor, Advanced Accelerator Application, and thank you to our gold sponsors, Lantheus and Raise Bio.